Hello, my name is Dr. Shahid. I'm a pediatrician and medical educator. This is a series of lectures that's going to be talking about preventing burnout and how to develop resilience for doctors and medical students. The topic of this session is going to be an overview of wellness, resilience, stress, and burnout. Future videos are going to cover other aspects of all these areas, and we'll cover that as we go through this particular lecture. So let's go ahead and get started. So physician burnout is a very important topic. Medscape does an annual survey of 15,000 physicians of various specialties and then talks about the rates of burnout, depression, and suicide. This is the report from 2019, and it summarizes the rate of burnout in the various specialties. So they use the Maslow burnout inventory, which is a common burnout rating scale. And what they found was that overall there was a burnout rate of 42% in physicians of all different specialties. And they again defined burnout based on the MBI, which is really about loss of enthusiasm at work, feelings of cynicism, and a low sense of personal accomplishment. So as you can see, the overall rate of burnout, again, was 42%, with the higher rates of burnout in specialties such as urology and neurology and PM&R, and even primary care like internal medicine and family medicine, where the rates are close to 50% or higher. And other specialties that are lower in the risk of burnout are listed there, but still the minimal or the lower rate of burnout is about 30%. So about 1 in 3 physicians in all various specialties is burnt out. So it's a very important topic that we need to address at all levels for practicing physicians, for residents and health staff, and also for medical students. So thankfully, there's a lot being done on this topic. And if you look at previous Medscape surveys, about 4 or 5 years ago, back in 2015, the overall rate of burnout was about 54%. So in the last 4 or 5 years, we've actually made some nice progress where the overall rate is down to 42%, but definitely a lot more needs to be done. So how about medical students? Are they at risk for burning out at a higher rate than the rest of the population? So this study looked at medical students and compared them to age-matched US college graduates. And they found that the risk of emotional exhaustion or the rate of emotional exhaustion was higher in medical students compared to their aged matched peers. Rates of depersonalization was higher, rate of burnout was higher, and they screened positive for depression at a higher rate than their age-matched college peers. So definitely something that needs to be addressed early in medical education. So I think it's very important to talk about this at the medical school level and also at the training level, and then also for practicing physicians. So just some background, as I said, this is an overview of wellness and burnout. Burnout, as defined by the Maslow burnout inventory, is a syndrome characterized by exhaustion, cynicism, and reduced effectiveness. And basically, you have a loss of enthusiasm for work, feelings of depersonalization, and a low sense of personal accomplishment. And why are doctors and medical students, why are they at risk for burning out? Because most people that go into the healthcare profession are high achievers. They're perfectionists. They will do some self-sacrifice and delay gratification as they're going through the education and training. And our culture really puts a constant demand on us because we have this can-do attitude and this must-do attitude, and that really increases expectations and puts the value on performance and achievement rather than on enjoyment, appreciation, and well-being. So this culture of excess limits time for reflection and appreciation and leaves us with feelings of negativity and hopelessness. So what are some of the repercussions of burnout? This is a great study by Tate Shanafelt, and basically covers the issues of burnout and the repercussions of burnout. So on the professional side, it can cause decreased quality of care and increased medical errors. It can cause decreased patient satisfaction, decreased productivity, and then increased physician turnover. On the personal side, it can lead to broken relationships, alcohol and substance use, depression, and even suicide. So clearly, something needs to be done to address burnout because there's very many negative repercussions in the professional side and on the personal side. So just a brief comment about stress versus burnout. Right, we're all under stress. We all have different types of stress and have to deal with stress, but that doesn't necessarily mean that you're burning out. So stress means that you are kind of over-engaged, meaning that your emotions are overreactive and that your demeanor is one of anxiety or hyperactivity. And this is just different from burnout, because burnout is disengagement, when your emotions are blunted and your demeanor is one of depression, detachment, helplessness, or hopelessness. So a little bit of a difference between the definition of stress and burnout that I think it's important for us to recognize. So stress, again, is the arousal of mind and body in response to demands made on them. Distress results when that arousal is too high or too low. And each of us actually have our own zone of positive stress or optimal stress. This is really highlighted nicely in this graph. So this is what's called a Yerkes-Dodson curve. So this was actually developed in 1908 by these two psychologists, Yerkes and Dodson, and they talked about different levels of stress. I can point them out here. So we all have an optimal level of stress that allows for us to have peak performance. And when we don't have enough stress, then we actually can be inactive or bored. And we have to have a certain amount of stress to motivate us and to allow us to focus, and then a kind of an optimal stress zone that leads to peak performance. But then as the stress level increases, we get into stress overload, and that can cause fatigue and exhaustion and even anxiety and burnout. And that's when our peak performance starts to come down. So again, we all have a zone of optimal stress where we have peak performance. But if we have too low stress, then we don't perform optimally and have peak performance. Or if we are stress overloaded, then our performance starts to come down as well. So I think this is important to recognize this curve and how we deal with stress and how our performance is affected by different levels of stress, and that we need a little bit of stress to motivate us and focus, but we don't want to go too far with excess stress, because then our peak performance starts to come down. Okay, so let's talk about wellness. I like this article because the authors make this comment that we must move beyond the pathological focus upon physician burnout and begin a conversation about what makes a physician well. So I like this approach because basically wellness and burnout are on opposite ends of the spectrum. Right. So you have wellness on one side and burnout on the other side. And they're saying that instead of focusing on burnout, which we definitely need to do, is how to prevent burnout. But let's also look at wellness. And how do we improve wellness? And how do we promote wellness? Because if we can improve wellness and promote wellness, that will then reduce the risk of burning out. So I like this paradigm that they're suggesting. So instead of looking at the glass half negative, half empty, and looking at the negative side and looking at burnout and why are we burning out and focusing on that, let's look at the glass being half positive and look at the positive side and the glass being half full, and saying that let's focus on wellness and promote wellness, because if we can improve wellness, promote wellness, that will therefore reduce the risk of burnout, because again, they're on opposite ends of the spectrum. So this is how I kind of view wellness and resilience. So as you can see, wellness and burnout, as I mentioned, are opposite ends of the spectrum. So if we can promote wellness, that will prevent burnout. And there's different ways of promoting wellness. I divide it up into developing resilience and then other ways to prevent burnout, depression, and suicide as well. And as you notice in my diagram here, again, this is my own visualization of wellness and resilience. I have these blue arrows that go back and forth between developing resilience and preventing burnout, because anything that develops resilience will also prevent burnout, and anything that prevents burnout will also develop resilience, and all of that will help increase and promote wellness. And then I further divided up developing resilience into wellness dimensions and resilience strategies. And then on this side, I have self-care and organizational strategies. But again, there's blue arrows going back and forth between each of these because, again, there's overlap. So anything that develops resilience, and these resilience strategies will develop resilience, but also will help prevent burnout. And anything, for example, that helps promote self-care will prevent burnout, but also will help develop resilience. So they're all kind of interchangeable and they're overlapping. So that's why I draw these blue arrows. So this is kind of my, again, overview of wellness and resilience and how I kind of visualize it. And we'll kind of go through this lecture, but also in future lecture series as well then. So let's define wellness. So the World Health Organization defines wellness as diverse, interconnected dimensions of physical, mental, and social well-being that extend beyond the traditional definition of health. It encompasses choices and activities aimed at achieving physical vitality, mental alacrity, social satisfaction, a sense of accomplishment, and personal fulfillment. So that's a lot to keep in mind. But I think this is kind of what the WHO has said that we have to consider as well. This definition of wellness is a little more succinct, and I like to use this from this article, in which the authors define wellness as a dynamic and ongoing process involving self-awareness and healthy choices, resulting in a successful, balanced lifestyle. So again, I like this definition because it highlights a few points of wellness that I think are very important. Number one, it's a dynamic and ongoing process. So wellness is ongoing and it changes. It goes up and it goes down. Your wellness is dynamic. It goes up and it goes down. And it's an ongoing process. So you have to keep working on developing wellness and developing resilience. It's not that you hear one lecture on wellness and resilience and now suddenly you're going to have wellness and well-being. No, it's an ongoing process that is continuously needing to be developed and worked upon. So I think that's an important concept. The other thing I like in this definition that involves self-awareness. So you have to be aware of what are the things that are potentially burning you out. What are the things that actually energize you? So once you have that awareness, you can maybe do more things that energize you and restore you and provide wellness and resilience. And maybe you could try to do less of those things that are putting you at risk for burning out. So you have to identify those and recognize those and be aware of those. So that's self-awareness. And through that self-awareness, then you make healthy choices, right? So you choose what to do or not to do, and how to respond to stress, and what type of wellness activities you're going to do to get over stressful situations. So you make these different choices once you have that awareness. And the goal of wellness is a successful, balanced lifestyle. So when you have wellness, when you promote wellness, the outcome is that you want to have a successful, balanced lifestyle where you can balance your personal life, your professional life, your school life, your work life, your home life, your family life, whatever it is. Every aspect of your life, you want to be nice and balanced, and that's the goal of wellness, to be able to do that. So I like this definition for all those reasons. Then. Okay, one other point to consider is that for wellness, that one size does not fit all, and that wellness needs to be individualized and personalized. And each of us must find strategies that work for us as individuals, meaning having self-awareness. So I think this is a very important point, that wellness is very different for everyone. For someone, one activity is going to allow them to have wellness and energize them. For someone else, that same activity is not going to have the same impact. So for example, meditation, some people will practice meditation or yoga or mindfulness, and that really energizes them and helps them get through stressful situations. For some people, they're just not into yoga and mindfulness and meditation, and that just doesn't work for them, right? So, this approach that sometimes we have in different organizations and institutions where, we require everyone to participate in some sort of wellness activity doesn't work that well because it's not going to be effective for everyone. So just because we're holding a mindfulness session and everybody has to participate doesn't mean that everyone's going to benefit from it. So I think we shouldn't. I think we should give lots of different options of different wellness activities for everyone, and then everyone is bound to have some sort of activity that they can relate to and benefit from. So I think it really needs to be individualized and personalized, and allow people to choose what activities and wellness activities that are being offered and being sponsored, what type of activities they should really take part in based on what they think is going to work best for them. So again, it must be individualized and personalized, and each one of us has to understand what activities work for us as an individual. What are the things that develop resilience in me? What are the things that allow me to be well and have that self-awareness, and reflect on that and recognize that. So if wellness is a process involving self-awareness, then we must develop strategies to increase the self-awareness of how we respond to stressful situations, i.e., we must develop resilience. So there's different definitions of resilience. In this article, the authors define resilience as the ability of an individual to respond to stress in a healthy, adaptive way, such that personal goals are achieved at minimal psychological and physical costs. So this portion of the definition is important, that we all have to deal with stress. And resilience is, how do you respond to that stress? Do you respond in a way that is healthy, productive, and adaptive, and does not expend a lot of energy? Or do you respond to stress in a way that expends a lot of energy, a lot of mental energy, a lot of psychological energy, a lot of emotional energy, a lot of physical energy, right? So when you have resilience, you can respond to stress in a healthy, adaptive way. But when you lack resilience, then you respond in an unhealthy way where you expend a lot of energy, and that puts you at risk for burning out. Resilient individuals not only bounce back rapidly after challenges, but they also grow stronger in the process. So that's part of resilience as well. It's not only to be able to respond to that stress and bounce back from that difficulty and that stress and that difficult situation, but you also learn from it and you grow from it, and you take something away from it, and you become stronger as a result of it. So that's all part of the definition of resilience. Okay, so resilience is also having the capacity to bend without breaking, to return to an original shape or condition, and to bounce back after encountering difficulty, and the ability to grow from adverse events and finding meaning in them. So this is all important aspects of resilience that we have to keep in mind that we're going to be talking about at future lectures as well then. Like I said, we all have to deal with stress, and resilience is how do you respond to that stress? Do you respond in a way that's healthy, that allows you to move forward, or do you respond in a way that is negative and maladaptive, and it really drains you emotionally, mentally, and physically? Again, when you have resilience, you do not expend a lot of energy because you respond to that stress in a very healthy, adaptive way. But when you lack resilience, that's when you get into trouble. That's when you burn a lot of energy in your response to that stressful situation because you lack resilience. So if we can improve resilience, we can then respond to stress in a more productive, adaptive, and healthy way, and therefore reduce the risk of burning out. I like this quote: more than education, more than experience, more than training, a person's level of resilience will determine who succeeds and fails. So again, it is so important to develop resilience because that is a key factor in helping us succeed. This quote I think is interesting because it talks about, it's not education, experience, and training that is key in helping someone succeed, but it's their level of resilience. And if you look at physicians, medical students, residents, health staff, practicing physicians, they are the most educated, most experienced, and most trained people, in the world. Yet they are still burning out because they don't have resilience, and they have trouble succeeding when they don't have resilience. So I think it's important to keep this quote in mind. Okay, so resilience, we know from the literature, may protect professionals from the common stressors of the workplace and personal stressors and the tendency to burn out. So again, resilience has been shown to help prevent burnouts. So I like to think of resilience as shifting the Yerkes-Dodson curve to the right. We had talked about this curve earlier, and I like to think of resilience as shifting the curve to the right. So originally when I said, we have this optimal level of stress, right, on the original curve, the optimal level of stress is around here, and that allows for peak performance. When you have resilience, it shifts the curve to the right. So this level of stress originally would have decreased our performance. But if we have resilience, then this level of stress allows us to maintain peak performance. So having resilience shifts the curve to the right. So that's how I like to kind of visualize what resilience does in our ability to respond to stress and be able to function optimally then. So there's an article out of Germany in which they interviewed about 200 different physicians, and they found that every fifth physician was burnt out or had some stress-related disorder. So they asked, what about the other fourth? And they found that they practiced resilient strategies. So in this study, they actually only found basically the burnout rate to be about 20%, which is a lot lower than some of the studies here in the US. This is an older study from 2013, so it's possible things have changed because the newer studies here in the US are, 40 to 50% of physicians are burning out. But when they interviewed these physicians, the 20% that were burnt out versus the 80% that were not, they found that the ones that were not burnt out practiced resilient strategies. And then they listed what are some of those resilience strategies that they practice. So they're listed here: leisure time activities, a quest for and cultivation of contact with colleagues, cultivation of relations with families and friends, cultivation of one's own professionalism, self-organization, ritualized time-out periods, spiritual practices, a useful attitude, acceptance and realism, self-awareness and reflection, recognizing when change is necessary, and appreciating the good things. So these are some of the things that they listed, and we're going to cover some of these in the upcoming lecture series, and we'll go into some more these details and some other aspects of resilience that we'll cover in upcoming lecture series. Okay, so a little comment about emotional intelligence and the role of emotional intelligence in developing resilience. So we know from the literature that emotional intelligence can affect behavioral responses to stress, and those with lower emotional intelligence are more likely to adopt maladaptive coping strategies, and that these maladaptive coping strategies can drain you emotionally, mentally, physically, and thereby promote burnout. So again, we know in the literature that individuals with high levels of emotional intelligence have the ability to better cope with stress. So increasing emotional intelligence levels may help develop coping mechanisms that are more adaptive to stressful situations and could promote resilience and prevent burnout. And this has been studied and shown that indeed that is true. So this is an article that was published in 2015, came out of the Ohio State University, in which they looked at first-year pediatric residents and med-peds residents, and they asked them to fill out different surveys on different aspects of their wellness and emotional intelligence and burnout. And what they found was that mindfulness, resilience, and self-compassion all helped prevent burnout. But what they also found was that emotional intelligence improved resilience, which therefore also prevented burnout. So this is one of the studies that has shown that increasing emotional intelligence will help promote resilience, which will therefore help promote burnout. So I think that's an important concept. And we're going to be talking about emotional intelligence and its role in developing resilience in upcoming lectures and videos as well then. So this is the overview of wellness that I like to look at, and looked at it earlier. We looked at the top half of this, and now I've included the rest of it. So again, wellness and burnout, I like to see them on the opposite ends of the spectrum. So if we can promote wellness, increase wellness, that will help prevent burnout. So that's the focus here. So again, developing resilience and then preventing burnout in the different areas. So you have wellness strategies on the left-hand side, and there's different wellness dimensions that we're going to talk about, and they can also all improve your resilience and your wellness. And there's resilience strategies that many are listed here. This is not all inclusive. There's many others that could be used, but these are some of the ones that we're going to be covering in upcoming lecture series. And then different aspects of self-care. And again, it's not all inclusive, but these are important ones and ones that are commonly talked about and have been studied to help promote self-care and therefore resilience and wellness and prevent burnout. And then organizational strategies and what could be done at the organizational level to help prevent burnout and promote wellness. So in upcoming lecture series, we're going to be talking a lot of these different aspects of wellness and resilience and self-care. Look forward to participating in those lectures and videos as well then. But at this point, I do want to just say a few words about these wellness dimensions. There's different dimensions of wellness, and here I list 8 of them. Much of the literature talks about these 8: emotional wellness, physical wellness, social wellness, intellectual wellness, spiritual wellness, financial wellness, environmental wellness, and occupational wellness. And the idea is to understand what each of these wellness areas are, and then to do some activities in each of these wellness areas to help your overall wellness, to help develop your wellness, promote wellness, and therefore prevent burnout. So there's different definitions of these areas of wellness, and there's lots of different wellness wheels that are available. This is one of the wellness wheels that is out there, and it defines the different areas of wellness and gives a little definition of what each one of these is. And again, the idea is to think about all these areas of wellness as part of the wellness wheel, and to identify some activities that you can do in each one of these areas, because that will really help balance that wheel and balance your wellness and promote your wellness. So I would encourage you to maybe take a minute or two at some point to reflect on these wellness dimensions. So here's like a worksheet maybe that you could think about kind of working through if you want. If you want, you could stop the video now and just take a couple minutes to kind of think about each one of these, maybe identify one idea in each one of these wellness dimensions that can promote your wellness. So you can do that now, stop the video and and kind of think about this and fill this out, or you can do it afterwards after completing the video as we're getting to the end here, and fill this out as well. But I would encourage you to maybe think about your own wellness in the light of these dimensions, and think about maybe one or two things in each of these areas that might help promote wellness in those areas. So maybe you want to you decide you want to call an old friend and reach out to an old friend, and that can really help your overall social wellness, right? Maybe you decide that you want to learn a new hobby, or maybe you want to learn how to cook, right? And that might help your intellectual wellness, or it might actually help your physical wellness because you're cooking on your own and you're eating more healthy then. Or you take on another hobby, photography or something else then. And maybe you want to improve your spiritual wellness by increasing the time you spend doing some sort of mindfulness activities or meditation or yoga or prayer, and that can improve your spiritual wellness. Or maybe you want to start to work out regularly and exercise regularly, and that can help your physical wellness. Or maybe you want to volunteer somewhere that can to help the community and to clean up a park or some area, and that can help with your environmental wellness. So again, maybe think of one or two activities in each one of these areas, and that can promote your wellness, and work on those areas, and that will help promote your wellness and then reduce your risk of burning out then. Okay, so as we get to the end here, I just want to end with a couple quotes, and then we'll summarize. So this is a quote from an article from back in 1927, right? So 1927, in this article, the author writes, "The secret of the care of the patient is caring for the patient," right? If you want to be able to care for your patient, the secret is you got to, just care for your patient, right? So then in 1995, somebody took this quote and modified it just a little bit, just tweaked it a little bit. So that's about 70 years later that somebody came by and said, we have to modify this quote a little bit, right? So in 1995, the quote was modified, and she modified the quote to say this: "The secret of the care of the patient is caring for oneself while caring for the patient," right? I think this is a very important concept, that we have to be able to care for ourselves. If we are going to care for our patients, we must first be able to care for ourselves. So self-care, overall wellness, resilience is so important. So if we want to effectively care for our patients, we first have to take care of ourselves. If we are not well, we will not be able to make our patients well and improve them and help them. So we have to take care of ourselves first. That's why I think it's so important to talk about these type of things related to self-care, to wellness, to well-being, to resilience, burnout prevention, because that is a secret of caring for the patient, is caring for oneself. And I think it's fascinating that this is what's said back in 1995. And here we are about 25 years later now, right? In 2020. So we are 25 years out from this quote, and we are still trying to figure out how to practice self-care, how to promote wellness, how to promote resilience, and how to prevent burnout, despite this quote coming out back in 1995. So I think that's something to think about. So as we summarize here, so again, this is the overview of wellness and how wellness can prevent burnout. And these are some of the topics that we're going to be talking about in this lecture series. So hopefully you'll participate in the lecture series. And we're going to talk a lot about these in specific under the resilience strategies. We're going to talk and take time to talk a lot about these specific resilience strategies over the next several lecture series. And I just want to point out the first 3 or 4 lecture series after this overview talk are going to be related to these areas of resilience, these top 6 or 7 areas that we're going to be talking about. And actually, if you look at these resilience strategies that I've highlighted, and you look at them a little more closely, they actually basically create a resilience program. So when you break down those first 7 resilience strategies that I highlight, they spell out the word program, and we're going to go over kind of a resilience program and how you can use this program to help promote wellness and promote resilience and help prevent burnout for medical students, residents, and practicing physicians. So we're going to be focusing in upcoming lecture series over probably 3 or 4 lectures. We're going to be talking about positive thinking, reframing, optimism, gratitude, reflection, altruism, and meaning. So these are some of the ones you're going to talk about as part of the resilience program. And then after that, we're going to hit other aspects of resilience and resilience strategies and other areas of wellness beyond these areas in future lectures as well. So I hope to see you at those upcoming lectures. So I want to thank you for your time and being a part of this, and look forward to seeing you at our resilience program series, and then other lecture series as well that cover other aspects of resilience in the future as well.